Hi everybody, this is Laurel coming to you from Ottawa, Canada. Today is November 23rd, 2010, and I'm pleased to bring you my numbers. On November 8th, I started my liquid diet, and I weighed in on my lovely little scale upstairs at 260. And this morning when I hopped on that beast, I was down to 246.5. So that's a total loss of 13.5 pounds, which is not that great, and it's not that bad either. But I was hoping for over 2 weeks worth of being on a liquid diet, it would have been at least 15 pounds. But anyway, I'll take it. A couple things I wanted to visit with you today were pre-screening for admission to the hospital yesterday and my visit to the deep vein thrombosis clinic. So because I'm a cancer patient, was a cancer patient, I am in remission. I am at a bit of a higher risk for having blood clots. And on top of that, being morbidly obese doesn't help the situation. So my surgeon wanted me to go have a visit with deep vein thrombosis before my surgery to see if they'd have any kind of a different treatment plan for me than the norm. So really the pressure cuffs, the pneumatic cuffs, the pressure stockings, elastic stockings, pressure cuffs, and the pneumatic I guess they're called pneumatic cuffs. They hook you up to that sort of just pulsate to kind of help with the blood flow. They're pretty normal, and in addition to that, they're going to give me blood thinners by injection for at least my hospital stay, which I'm to expect to be 5 days. 5 days because I had radiation to my left side of my chest from midline across, so there is a possibility that the outside of my stomach could have been slightly radiated and I may take longer to heal. Bleeds or leaks are a higher risk for me than the norm, so that would be why the longer hospital stay. Everything with pre-admission went really well. Blood pressure was like 111 over 60. My pulse was 66. That was all great. I wanted to just talk quickly about a product that my dietitian, as part of the program, she recommended. And it comes from the lovely USA, I should add. And if I'm ordering it up north here in Canada and having to pay duty and taxes and all the rest of it on it, it's going to be pretty good. And I'm really quite glad she turned me on to it because it is quite a nice product. You can order a starter pack from them. I think it's about $18, and they send you some smaller packets of their sort of sample or individual sizes with one serving. So you can try it before you buy it, sort of thing. It is a medical quality protein supplements. I'm sorry I haven't figured out how to turn my mirror image so that I can get the printing proper, but I'm still learning at this. So Unjury, they have strawberry, they have unflavored, they have chocolate classic, they have chocolate splendor, unflavored, and then they also have one chicken soup. Chicken soup one, though, is the one that I am most excited about because I know that the 60 to 80 grams of protein for your daily intake post-op, that's kind of daunting, especially when you're not consuming a lot. So I'm excited about this because you can add it to things like mashed potatoes or like mashed sweet potatoes and carrots, or, you can throw it into some soup or stew or really anything, because you can heat it up, right? So you're boosting your protein intake, and it gives you some variety. I know I don't relish the idea of sitting around drinking cold protein shakes all day. The chocolate, you can make a hot chocolate with it. I think the cutoff temperature is 130 degrees, so it can't be boiling point. But it's quite a lovely product. It's nutritionally sound, and again, it's formulated by dietitians and physicians, particularly for the bariatric patient. So I'll put the link to that, or not the link, but the website address at the end of the video. Also with some body shots that my husband took last night, and I was kind of disappointed, but I suppose I'm just in denial about those pictures because I'm like, what the heck was I expecting? They're not very pretty. And I also wanted to talk about things I'm packing. And no, I don't own a gun. It's the stuff going into my suitcase. Wanted to talk briefly about neck roll after laparoscopy surgery because of the gases that they inflate you with so they can maneuver around. It kind of leaves you with a bit of a stiff and sore neck. So I thought I'd bring one along, and if I find it's useful, then great. If not, oh well, just bring it home. Breathe Right strips, the little, they look like a little Band-Aid strip, and they stick on your nose and they kind of pull your nasal passage open a little bit. I do find them useful to use at home on occasion, especially if my asthma is acting up at all. So I thought I'd bring those just in case I find that I'm a bit stuffed up. Also, on my past hospital visits, I have always found this to be a really comforting thing, is I've brought in my own pillows and my own duvet. And the reason for this is that I don't like sleeping on a vinyl-coated mattress. Call me princess, call me high maintenance, call me what you like, but I like to be comfortable. And if I'm comfortable, I'm going to rest better. And if I rest better, then I'm healing better and faster. And if I'm healing faster, the sooner I can begin my new beginning, my second chance at life. I also bring in my own pillows because the pillows are also vinyl coated. This is for sanitation reasons. But also the pillowcases and the sheets and things. I mean, I don't bring in my own sheets and make my bed again, but I do sometimes put like a flannelette flat sheet underneath me, so my skin's not touching, or I'm not next to the starchy, scratchy, sterilized, crispy sheets and pillows. The vinyl ones that your head sweats on. Anyway, I thought I'd share it because I always find I get a really good night's sleep when I do that. Nobody's ever complained. It's not like I show up with, an entourage and 15,000 suitcases. It's just my blankie. Yeah, so I think that's it for now. Surgeries and 6 more sleeps. I'm so excited and I am so nervous. But that's, I think, pretty normal. I'd be worried if I wasn't a little bit anxious about it, to be quite honest. Just my thoughts go out to those who are entering into their surgeries in the next week, and hope everything goes really well for you, and everybody that's been through it are recovering well. And that's all for now, everyone. Try to make a video when I'm in the hospital. I'll make a disclosure right now. I want to get this right out of the way. And my Irish setter wants outside, and probably the golden retriever, Fred and Ginger. Yeah, Ginger Rogers and Fred Astaire. I just want to get this out of the way. I will make videos in the hospital. I will not be held responsible for the content. I will not be held accountable for what I may or may not say. Yeah, because you don't know what they're giving you, and anyhow. I'm trying to be funny, but it's not coming across as very funny. Just take it for what it's worth. It is what it is, and I better stop. That's all for now. Cheers, everyone. Talk to you next week. Thanks. Bye.